After participants then complete 4 blocks of the REACH trials, and there are 8 REACH trials per block, then participants will reach the target as quickly and accurately as possible. The verbal cue will initialize each trial, and for the action selection condition, the cues in the center of the monitor screen will be presented, so green sphere and red cube, and those research and experimental procedures have already been done in similar research with Stewart and Smith in 2014 and in 2018. And then for the controlled execution only condition, participants reach only to the target with a pre-selected arm, so they'll already know which arm to reach with, a left reach with the left arm, a right reach with the dominant right arm, so on and so forth. And they will be void of that visual cueing that the action selection received, so there is no reaction time, there is no response time, there is no choice involved with the execution only because they are the control. That concludes my research presentation. I'll open it up to questions. So we have a question from the audience about gaps in the research. The main gaps in my dissertation will fill theoretical gaps in the current literature. The theoretical gaps are these. Do we plan parallel or non-parallel? This research dissertation will attempt to close that gap and fill that gap by interpreting the results of the action selection and execution only. So if the action selection group has longer reaction times, longer response times, longer movement times, if even their reach performance is altered in some way because of the choice, then we know that planning is probably non-parallel. If planning were parallel, then you wouldn't see as much of a change or an adaptation due to action selection or choice. So that's the theoretical gap that will be filled with this dissertation. In terms of audience, generalizing the data, a lot of this data can help occupational and physical therapy students or clinicians for stroke patients, Parkinson's patients, especially when it comes to relearning how to drive or everyday activities of daily living. And that's why the importance and scope of this dissertation could be enormous. However, for the experimental procedures, we didn't want to include all the different clinical populations and the sports populations and the non-athlete populations. We just wanted to get a basic benchmark, even though there have been several studies on young healthies in this realm, this scope of reach performance among young healthies, this exact paradigm, and then trying to fill the gap of parallel versus non-parallel has not been filled. And therefore, the generalizability of the data could be enormous. However, in reality, matching our sample population to clinical populations would not be advisable, even though further research after this research dissertation could delve deeper into the realms of Parkinson's and stroke, especially ischemic stroke. However, I would not suggest reading this dissertation when it's completed and translating it to those clinical populations without that step of then changing the sample population to a more clinical scope. Thank you.